Lovely people, we are here once again to talk about the liver. You know that the liver is a powerful organ that helps, that helps to reduce toxins from the system. Now, how does the liver reduce toxins? The liver serves as a filter. So anything that we take in inside the body, it has to pass through the liver for the liver to filter it before it has ability to enter into the bloodstream. That makes what the liver a powerful organ. Now, the reason being that the liver has so many functions that we are going to talk about. Now when it comes to excretion and then also production of bile, it is the duty of the liver to do all these things. So we'll talk more about it. Now we have several types of liver diseases. And some are treatable with lifestyle changes, some are treatable with diet, some are also treatable with medications. Then we need to understand that, because it depends on the cause of the liver diseases. Now, let us look at the function of the liver. The function of the liver. Now, filtering toxins from the blood. So the liver has ability to filter toxins from the blood, especially when it comes to drugs. When it comes to drugs, it is the duty of the liver to filter, especially when there is an overdose of medication. The liver will make every possible means, in order to filter this particular, at least some of the poisons, from the drugs before it gets into the blood, into the bloodstream. And alcohol intake. Alcohol has ability to destroy the liver, especially when you become a chronic alcoholic. You know that it is the duty of the liver to filter the alcohol, because the alcohol is very toxic. So when you take in, the liver will do all that. So if the strength of the alcohol or the toxins from the alcohol becomes stronger, then it means that the liver is going to be affected severely. And sometimes poisons too. Poison. The liver will filter all these poisons before they find their way into the bloodstream. That is one of the functions of the liver. And then also the liver also produces bile, and then it's also what causes what excretion. So it produces the bile and then has ability to cause what excretion. So take notice of that. And then storage of glycogen. The liver is one of the that's the one function of the liver. Storage of glycogen, vitamins, and some minerals, and also enzyme activation. All these functions are done by the liver. So we take notice of that. Enzyme activation. And then the liver also synthesize plasma proteins like albumin, and then also they also synthesize what? Clot factors. Clot factors. So the function are numerous. The functions are voluminous. So we will talk more. These are the few that we are going to talk about it. Now, we know there are several things that can cause liver diseases. So let's go and look at some of the causes of liver diseases. Causes of liver diseases. Virus infection. Especially when you look at hepatitis. Hepatitis can cause liver problem. We'll find one time to one day to talk about hepatitis as a topic on its own. Hepatitis affect the liver, and it is caused by what? A virus. So take notice of that. And then alcohol intake also causes what? Liver diseases. So when you become an chronic alcoholic, you know how strong alcohol is. And imagine you taking alcohol and it's getting into the bloodstream without the liver. You understand? You do the liver filtering it. Filter it. That is going to make a very serious toxic in the system. So that is very, very dangerous. And then obesity. Obesity can be a risk factor for liver disease. So let's take notice of that. And then acetaminophen overdose, especially as we know, this is the generic name. Acetaminophen is talking about paracetamol. Look, there was a research some time back, that stated that 500 milligram of paracetamol, talking about a tablet, can cause 10,000 cells of the liver damage. So that tells you that 10,000 cells of the liver is going to be damaged by just 500 milligram of paracetamol, or just one tablet, 500 milligram. So if you take 1 gram, okay, at a particular time, it's going to destroy 20,000 liver cells. So that should tell you that acetaminophen, which is paracetamol, is very dangerous for the liver. So when you overdose it, you know the consequences. And then some herbal medications. Some people take the herbal medication without measuring it. Okay, if you don't know the dosage of the herbal medication, please don't take it because of the what? Because of the effect that they are going to have on the liver. Because the liver will come in to filter, the unwanted poisonous, or toxic part of the what? Of the what do you call it, of the medication, and that can cause the liver being destroyed. And also eating poisonous wild mushroom, okay, can also lead to this. And then autoimmune hepatitis, there's one particular condition of this autoimmune hepatitis. Okay, it's part of the hepatitis, but this one is caused by the immune system. Okay, so let's take notice of that. And then Wilson's disease. Now, Wilson's disease is just a genetic disorder. All right. Now, genetic disorder that prevents the body from removing copper, which build up, okay, in your liver, and damages it. So imagine if a copper, okay, is not has not been able to eliminate, to excrete this, and then there's going to be a build up of this particular copper within the liver, and then the more it builds up, the more it destroys the liver. So take notice of that, especially when you look at those people who work at the industrial areas. Okay, whenever there is a too much build up of copper in the system, you know the consequences. So take notice of that. And then also acute fatty liver of pregnancy. Okay, it can also lead to this particular liver diseases. And then industrial toxins like the mercury, those who work in the mining areas, those who work in the industrial areas. Okay, there are some chemicals that are very dangerous to the liver, because when we eat it, okay, or when we ingest it, it's going to enter into the system, and then the liver is the target organ, okay, before it gets into the bloodstream. This has ability to destroy the liver. So take notice of that. Now, we have types of liver failure. Several types of liver failure. Okay, it can be acute, it can be chronic. Then we have also stages of liver diseases. So now let's look at the acute one. Now the acute one here, the liver stops working within a matter of days, and then it resolves. And that one, okay, sometimes the symptoms might not manifest, but whenever the symptoms start, it becomes acute or it becomes sudden. That tells you that there is a problem, and it can be caused by either hepatitis or overdose of acetaminophen or paracetamol. So take notice of that. And then when it comes to the chronic means that the liver has been destroyed for a very long time. Okay, imagine chronic, meaning the effect on the liver has been there for a very long time. This means that there's going to be a severe damage of the liver cells, and there's going to be a scar formation. Now, when the scar formation happens, what happens is that, okay, blood supply to the liver is going to be reduced, because we know that when it comes to scar tissues, okay, you wouldn't see any blood vessels running through them, meaning there's going to be a decrease in blood supply to these areas. That's what happened to the liver whenever the damage becomes chronic. So take notice of that. And then it can it can be due to alcohol, especially those chronic alcoholic people. And then fatty liver disease can also cause this particular issue. So take notice of that. Now, what are some of the early signs of liver disease? Early signs and symptoms of liver diseases. We have nausea, fatigue, okay, you easily get tired, okay, and then vomiting is also going to be there, stomach pain, loss of appetite, and then diarrhea. All these things can happen, okay, as an early sign of liver disease. So when you have these signs, please quickly go to the hospital to check or consult your doctor for any possible treatment if you have this particular condition. So take note of that. Now let's look at the late signs. The late signs means that now you have contracted the condition or the disease, okay, and then for a very long time, and these particular symptoms okay, is manifesting late sign, those that the signs are something that can be seen later, or the assessment finding that can be seen later. You are going to have jaundice, especially yellowish of the sclera, all right, on the yellowish of what, of the skin. Okay, you are going to see jaundice in your eyes, and then your skin, and then easily bleeding. Okay, your clotting factors are going to be affected, so you bleed. All right, and then also ascites. Ascites means swollen abdomen due to accumulation of fluid within the abdomen. That's what people mostly see as what, as the individual having a liver condition. Why? Because the abdomen becomes bigger due to what, fluid being accumulated there. So when it happens, so you need to tap to remove some of the fluid. Okay, that tells you that the extent of the liver damage is so severe. And then mental confusion is also going to, especially hepatic encephalopathy. That's how we call it. Hepatic encephalopathy here is due to what? Accumulation of ammonia that has ability to enter into the brain to cause confusion and other brain symptoms. We call it what? Hepatic encephalopathy. And then sleepiness. The individual will sleep. Okay, small time he is sleeping. Small time he is sleeping. You know, it tells you that the person is what, is having a very serious effect on the liver. And then also pruritus, itching. Okay, itching of the on the skin. Okay, itching on the skin is going to happen. So you scratch. And then musty smelling, indigestion of fat. Yes, you know, we need a bar to digest the fat. Now, when the liver is having a problem, bar production is also going to be reduced. So fatty digestion is going to be a problem. And then also the urine will be dark urine. Okay, due to the a problem with the bar, and then the jaundice. Okay, dark urine is going to happen, and then ankle edema is also going to happen. So if you enjoy the lecture, please try to subscribe. Okay, and then we'll talk more about the what do you call it, the diagnosis, and then the management. Some of the diet that needs what, that we need to what, to use in order to modify our system, so that we don't have the condition, or even if we have it, those things that we need to do in order to reduce it. Thank you very much. Please contact us for all your increased needs. Okay, if you are a beginner or you are advanced and then you need to polish up or you need to start afresh, please contact American Dream Increase Prep for all your increased needs. Thank you. Let's continue next time for the management and the diet that we need to for this particular liver problem. Thank you very much once again.